Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Vaginismus is a distressing and often painful condition in which the muscles around the vaginal opening involuntarily contract or spasm in response to attempted vaginal penetration. This condition can make sexual intercourse, gynecological examination, and even tampon insertion extremely uncomfortable or even impossible. Let's try to look at the causes, symptoms, and treatment of vaginismus in detail. So what are the causes? The causes of vaginismus can be complex and multifactorial, often involving both physical and psychological factors. These may include fear or anxiety. If there was a past traumatic sexual experience, fear of pain, or anxiety related to sex, it can contribute to vaginismus. There can be relationship issues, problems in the relationship, communication, or emotional intimacy with a partner can also lead to vaginismus. There could be physical factors as well, such as infections or irritations. Past vaginal infections or irritations may trigger a fear response and muscle contractions. Strangely, childbirth can also be a cause. Traumatic or difficult childbirth experiences can lead to muscle spasms. Some medical conditions like vulvodynia or endometriosis can be associated with vaginismus. So the symptoms, primary symptom of vaginismus is the involuntary contraction or spasm of vaginal muscles when penetration is attempted. This can result in pain or discomfort. Attempted penetration is often painful or impossible due to tightness and muscle spasms. Anxiety and distress. Vaginismus can lead to significant emotional distress, fear of intimacy, and avoidance of sexual activity. It can have an impact on relationships. The condition can strain relationships between a couple due to sexual difficulties and communication challenges. So, what are the treatment options? Vaginismus is treatable, and the choice of treatment depends mostly on its underlying cause. So, what are the common approaches? Pelvic floor physical therapy often involves working with a trained physical therapist who specializes in pelvic health. They can teach relaxation techniques, exercises, and stretches to look at the muscle tension and spasms. Counseling or psychotherapy also helps. Sex therapy or cognitive behavioral therapy can help address underlying psychological factors contributing to vaginismus. Therapy focuses on reducing anxiety, improving sexual communication, and changing negative thought patterns. Education and sensate focus also helps. Couple can benefit from education about female anatomy, sexual function, and relaxation techniques. Sensate focus exercises can help couple gradually reintroduce sexual intimacy in a comfortable and non-threatening manner. Medical evaluation is also essential. If vaginismus is thought to be related to a physical factor or medical conditions, a gynecological evaluation may be necessary. Treating any underlying infection, then there is the dilator therapy. Graduated vaginal dilators can be used to gently stretch and desensitize the vaginal muscles over time. This therapy is often combined with pelvic floor exercises and counseling. Then medications also work. In some cases, medications such as muscle relaxants or low-dose tricyclic antidepressants may also be prescribed to help reduce muscle spasm and anxiety. In rare instances where physical abnormalities contribute to vaginismus, surgical intervention may be considered. It's essential for individuals experiencing vaginismus to seek help from a gynecologist who specializes in sexual health and therapy. Successful treatment often requires patience, support from a partner, and comprehensive approach addressing both physical and psychological aspects of the condition. With appropriate treatment and support, many individuals with vaginismus can overcome the condition and enjoy satisfying sexual relationships. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.